The previous slide consists of real quotes from OCD sufferers. Most of us have at least heard the term OCD before, and we know what it stands for: obsessive compulsive disorder. Perhaps we've heard it used in conversation before to refer to being excessively neat or meticulous. But what is obsessive compulsive disorder really? OCD is a psychiatric disorder that manifests itself as an individual repeatedly having distressing, intrusive thoughts. This is the obsession aspect of it. Those suffering from this disorder also feel the need to perform specific compulsions or rituals. If rituals are not performed, the individual will experience a heightened sense of anxiety. Most sufferers believe that these behaviors are not rational, but their anxiety overrules this. Although the subject of mental health has thankfully become a more commonplace topic, OCD remains quite stigmatized. Society tends to reduce this disorder to being obsessively perfectionistic or clean. This is a largely inaccurate depiction of obsessions and compulsions. As it is, these rituals can have a very isolating effect on the lives of their sufferers, and this stigma only serves to make those affected by OCD feel more alone. OCD is so much more than being fastidious and perfectionistic. With that, let us address some common obsessions and compulsions that most sufferers truly do experience. One common obsession is contamination. Contamination OCD is a subset of the disorder that makes up an estimated 25% of all OCD cases, wherein those affected fear some sort of uncleanliness or contamination. While common, this is far from the only way OCD presents itself. Also fairly common are symmetry and ordering obsessions, in which there is an intense desire for evenness or arranging items in a particular order. A fear of losing control is another common theme in obsessions and intrusive thoughts. Those who fear losing control worry about unintentionally harming themselves or others, or have a fear of uncontrollably saying obscenities or insults or acting on any other unwanted impulse. Other anxiety-provoking intrusions include unwanted or disturbing sexual thoughts, or intrusive thoughts of a religious nature. This is also known as scrupulosity. While all of the previously mentioned obsessions are common, this is far from an exhaustive list. Many individuals have obsessions unique to them, or experience multiple obsessions at a time. Aside from the mental aspect, OCD is largely behavioral. As previously mentioned, compulsions, or rituals, are actions typically performed in response to obsessive thoughts to neutralize the anxiety they cause. Often, but not always, they are related to the obsessive thoughts. Very common are cleaning compulsions, consisting of excessive washing or cleaning of the hands, body, or object. Also common are checking and repetition compulsions. An individual with a checking compulsion will repeatedly check to make sure that a task was performed, such as turning off the stove or locking the door. An individual with a repetition compulsion will often repeatedly perform a simple task or movement multiple times, often in multiples of a specific number. Counting rituals are also common as well. Hoarding is actually also a form of OCD. Often stemming from loss or a need to control, hoarding occurs when an individual feels unable to part with items or throw them away, resulting in a great excess of collected objects. Some other compulsions or rituals include mental rituals, obsessive praying, often in response to scrupulosity, or the need to ask for reassurance or confess, also often related to scrupulosity obsessions. As mentioned previously, OCD rituals often correlate with obsessions. So, where does OCD originate? Well, it's thought to come from a part of the brain known as the orbital frontal cortex. This part of the brain makes up an area known as the OCD circuit. PET scans of the brain show increased activity in this OCD circuit that decreases following treatment that's successful. New research findings also indicate that certain cases of OCD can be triggered by common illnesses such as strep throat. Often found in children and estimated to account for 1/3 of all childhood cases of OCD, this syndrome is called Pediatric Acute Onset Neuropsychiatric Syndrome, or PANS as an acronym. This slide illustrates the onset of PANS, which occurs when autoimmune antibodies attack the basal ganglia of the brain. OCD is typically evaluated and diagnosed by the following 4 factors shown on this slide. It is worth evaluating OCD patients for comorbid disorders as well, especially if they are resistant to treatment. Children who may have autoimmune-related OCD should be diagnosed by different criteria, as PANS has slightly different symptoms. Specific therapies that have been shown to be helpful in the treatment of OCD are cognitive behavioral therapy and exposure response therapy. Cognitive therapy, or CBT, is used to combat the obsessive aspect of OCD and the thoughts, while ERP diminishes the need for compulsions through exposures. Medications, such as SSRIs or, in severe cases, atypical antipsychotics, are also used. However, medications of any type work best in addition to psychotherapy, such as ERP or CBT. Studies have shown that children and adolescents with PANS have responded very positively and had a dramatic reduction in symptoms after receiving IVIG therapy, or immunoglobulin therapy, to combat the autoimmune aspect of their disorder. As I bring this presentation to a close, as well as my own story included on the slide, I feel it is important to mention that the future for individuals with OCD is becoming increasingly brighter. I'm sure in the future it will continue to be so. More attention and funding will be devoted to studies on this topic. OCD is a very difficult disorder to deal with, but it is no match for the resilient people diagnosed with it. I'm Abigail Kelly. Thank you for listening.